Hey everybody, I'm Tim Kaine, Senator from Virginia, and I wanted to join you today to talk about an issue that's critically important to every American, health care, and to share some good news and some bad news. You deserve the peace of mind that if you or a loved one gets sick, that you can get health care when you need it without losing your house or facing mountains of debt. Because health care is a right, not something reserved just for those who can afford it. That's why I've consistently pushed for reforms to expand access to quality, affordable care. The Affordable Care Act helped us provide health insurance to millions of Americans, but it wasn't perfect, and that's why so many of us have pushed for improvements to the law. And it's also why I've been such a vocal advocate about the need for states to expand Medicaid. In Virginia, for years, Republican lawmakers stood in the way of hundreds of thousands of Virginians receiving care while still leaving taxpayers footing the bill. But last year's elections in Virginia paved the way for a state legislature and state officials that were finally ready to right this wrong. I'm so proud that last week the Virginia General Assembly passed legislation to expand access to health care to up to 400,000 additional Virginians. This huge accomplishment will help people get the care they need. Our communities will be healthier as a result, and I'm so thankful for everyone in Virginia who fought tirelessly to make this happen. But while Virginia has fought for progress, the Trump administration's actions over the past year have weakened our healthcare system across the country and threatened access to care in Virginia and everywhere. First, Republicans tried again and again to repeal the Affordable Care Act, which millions of Americans rely on for care. With the help of so many of you who raised your voices, Democrats in the Senate and a few of our Republican colleagues successfully defended the ACA, and we protected health care for millions of families. When the Trump administration failed to repeal the ACA, they settled for strategic attacks that have increased premium costs for American families. From eliminating the coverage requirement, to reducing the ACA enrollment period, to cutting off cost-saving reduction payments, the Trump administration and Republicans in Congress have repeatedly taken steps to sabotage health care in America. Just a few weeks ago, insurers announced that they're proposing to raise premiums as much as 64% on Virginia families who get their care through the individual market, and most cited the Trump administration's actions as reason for these premium increases. And in the weeks since, we've seen similar announcements for Maryland, New York, and Washington. Well, I won't stand idly by as Virginians are stuck with the painful consequences of the Trump administration's sabotage. It's very important that we not only act in ways to preserve the Affordable Care Act, but also act to make it better. We need to pass a bill like the bipartisan Murray Alexander legislation that we've worked on to stabilize the health care market for the future. And I hope Congress will take up my Medicare X bill to provide more options for low-cost, high-quality care in every zip code, boosting competition and bringing down prices. My bill that I've worked on with Senator Bennet of Colorado would build on the Medicare framework to establish a public insurance plan offered on the individual and small business health exchanges. This would allow Americans to choose among the existing private insurance plans or a meaningful public plan. It would be particularly helpful in rural communities across the country where often there are limited options and prices are too high. I hope Senate Republicans and President Trump will finally join Democrats who are asking Leader McConnell to spend the month of August working to pass proposals like these that bring down the price of insurance and prescription drugs for families. We need to continue the recent progress we've made in Virginia and expand access to affordable health care at the federal level. My Democratic colleagues in the Senate, we're joined together to do all we can to protect health care. And I hope our Republican colleagues will join us in efforts to make health care more affordable and accessible to all. And we're going to keep encouraging the Trump administration to stop playing games that drive up health insurance costs for American families. The only way to get health care right in this country is for us to focus on real solutions that will work for folks across the country. It's time to strengthen, not weaken, our healthcare system for all.